Alrighty, so next we'll start, the next part of the exam will be looking at the upper extremities. So we'll go ahead and we'll start with the shoulder and we'll start with inspection. So we're going to look on the anterior side first. Just kind of look up here. Alrighty, and then you won't probably need to come around, but you'll want to get like a posterior view. And there's no any lesions or deformities on either side. No signs of any redness, any erythema. So then that'll be good with that. So then we'll move on to palpation. So we'll kind of come right here. This will be just clavicle. So we'll go right here. There's his SC joint. Come here. There's his clavicle. And then let's see. I know this might be a little tender, so let me know. I think right there. That should be the AC joint. Sorry, does that hurt?
No, you're good.
And then right above that should be. Chromium should be right there, and then right underneath that. Sorry, I know that might be a little tender to feel. Feel for the coracoid. I think right about there. Sorry.
Good. No.
Alrighty, so then that would finish up that, and then we'll also look at the scapula. But to kind of just save time on the video, you'll want to make sure you do that bilaterally so you'd feel across there. So then the scapula, that would be starting back there with no any abnormalities found. Was there any tenderness with that? All right, no tenderness noted. Let's see, and then we'll go ahead. Let's just look back here. We'll kind of palpate the scapula too. Sorry, and you'll let me know. So we'll kind of work our way down the medial spine of it. Here. Alrighty. So no deformities on that back part. Was there any tenderness with that?
Nope.
Alright, no tenderness noted or any swelling. So then we'll go to testing range of motion. So we'll test adduction. Or we'll test abduction first. So if you kind of sit there, raise your arms up above your head like that, bring them back down. That's adduction. And then we'll go ahead and we'll test flexion and extension. So I'll have you kind of, with your thumbs facing forward, raise them forward like that, up. All right, and you're gonna have to kind of, excuse the table, but then bring them back down and then bring them behind you. That, takes extension. And we'll do internal and external rotation, so you can bring them back. So then I'll have you do this, and then I'll have you bring them in this way, and then back out this way. Try and keep your elbows in as much as you can. Alrighty. So that'll finish up range of motion. Patient has full active range of motion. So then we'll go ahead and test strength against resistance. So I'll have you kind of cross your shoulders like that. All right, I'm gonna come back here. I'm gonna push down. Don't let me push down, okay?
Go.
All right, patient has a full 5 out of 5 with that. And then I'll have you, let's see, we'll do it this way. All right, I'm gonna kind of resist them, but bring your arms down for me to your side. All right, and then don't let me push up. All righty. So that tests abduction and adduction, strength against resistance, 5 out of 5. So then we'll move on and we will look at the elbow. So then we'll do this, and then again, you always want to do things bilaterally, but I'll try and save us some time with everything. So I'll come back here, rest it on my arm. So we'll come back here, look at the elbow first of all, inspection. No swelling, no abnormal redness, no lesions or cuts or deformities. So then we'll go to palpation, feel the olecranon. We'll come up here, I'll have you kind of turn your hand like that. And right there, that would be his radial head. and then above that you'll feel your epicondyle. So that'll be the lateral epicondyle, which is a little bit more prominent. You'll come over here, and then we'll test the medial epicondyle. You want to feel for that kind of groove, which is right there. So that's it right there. Alright. Was there any tenderness with that?
Nope.
No tenderness or abnormalities found with that. So then we will go on and test range of motion. So elbows, I'll have you bring them up this way, bring them back down, and then let's see. All right, and then you're gonna kind of want to bend your elbows for me this way, and then they're already in supination, but I'll have you turn your hands down, turn your hands back up. That's supination, the pronation, which you did completely. So that would be full range of motion. Then we'll go ahead and we'll test strength against resistance. So then I'll do it on this arm. So I'll have you bend your arm up for me like this. I'm gonna put my hand here, and I'm gonna try and pull. Don't let me pull down, all right? All right, patient has a full 5 out of 5 with that. And then we'll do it this way, so bring your arm back up, and bring your arm down, and I'm gonna push against you, don't let me. Alrighty, patient has a full 5 out of 5 with that. No abnormalities found. So then we'll go ahead and we'll look at the wrist. So then I'll see your wrist. Again, do that bilaterally. So we'll look at the wrist. Sorry, I know the lighting might be bad. Bring it this way. No swelling or abnormalities noted, no lesions, atrophy, or anything with that. So then we'll palpate the radial and ulnar styloids. So I know that's kind of pinch and like pull down. So I feel these right there. It might be hard to see in the video, sorry. Alrighty, radial, ulnar. Alrighty, and then we'll feel the carpal bone, so that'll be on the top part of his hand. Just, Alrighty, and then I know in the video we talked, I'll kind of have you like flex your hand like I am mine, and then you'll feel that like snuff box right here, and you can kind of feel for that scaphoid. I'll kind of move your hand, kind of relax your hand. I'm gonna move it kind of side to side. And you can passively, sorry, I don't wanna hurt you. You can feel that scaphoid. And then we'll go ahead and we'll test range of motion. So then, let's see, if I have to look at this. Here we go. I'm gonna have you look at your, and then kind of wave to me. Not your whole hand, just kind of, I know you won't be able to move it too well, but that way. There you go. That says radial and ulnar movement bilaterally. So there's no abnormal things with that. And then we'll test flexion and extension, so hold your hand out, kind of turn it this way to the side. Bring your hand up, bring your hand down. Alrighty. That test flexion and extension. Patient has active full range of motion, so then we'll go ahead and we'll test strength against resistance. So then I'm gonna kind of bring your hand this way. Don't let me, oh, kind of turn your, we'll kind of do it that way. Don't let me push your hand down, okay? Alright, and then kind of bring your hand down this way. Alright, I know that's kind of hard. Actually, put your hand up this way. And then I'm gonna have you push down, okay? Alrighty, patient has 5 out of 5 strength against resistance. So then the last part, we'll just move on to the fingers of the hand. So then we'll inspect the phalanges in the hand. Move it this way. No deformities, cuts, lesions, abnormal swelling or anything like that. So then we'll go ahead and then palpate, so we'll feel for the metacarpals, which we already did previously, but we'll feel kind of there again. 2, 3, 4, and 5. And we'll feel the MCP joints, so these are your big knuckles. and then your DIP and PIP, and on your thumb you don't have that, but you would just have this one right here, and then your DIP on your others. So those will be those. Does that hurt?
No.
And then we'll go up here. Alrighty, and then we'll just kind of squeeze up against, feel the phalanges. Alrighty, any tenderness with that? No tenderness or deformities found with that. And then the last part, we'll just move on to range of motion and resistance. So let's see, let me think about this. Sorry. Let's see, alright. Extend your hands, bring your hands together. Alrighty, and then I'm gonna have you do this with your thumb. This is the opposition of the thumb. Nope, with your pinky. Bring it together like that. So that's the opposition of the thumb. So patient has active full range of motion, and then we'll go ahead and test strength against resistance. So I'm gonna put my hands, bring it down this way. I'm gonna put my hands in between here, squeeze my fingers, squeeze them in, then squeeze them back out. Alrighty. Patient has strength against that, and then I'm gonna have you do that thing again. Put your pinky and thumb together. I'm gonna hook in between it. Don't let me pull my fingers out, okay? Alright. And then we'll test grip strength, so then we'll use our two fingers like this, and then you won't do that. I'm just gonna put my hands in your palms, squeeze them. Alright. Alrighty. Symmetrical grip. And then that would finish up strength against resistance, which is 5 out of 5. And that would complete the upper extremity exam, and then we'll move on to lower extremities.